Hapa Kibera, mtoto msichana, changamoto ya kwanza ni marafiki, peer pressure.
Most of the people that are in this base, they are not busy. If they get small coin, bang, tobacco, 50 bob, it's enough for you to get miraa that you can chew the whole night.
Currently, we are having the diseases which we are calling lifestyle diseases. This is cancer, diabetes, and hypertension. Most people who have got this disease, they always come late. In fact, they die before they see the doctor because these diseases are not painful, and someone just collapses at once.
NCDs is growing so fast compared to the infectious diseases. Kibra and Langata is also not left behind. The numbers are increasingly going high. We realize quite a number of clients are being diagnosed on a daily basis on the non-communicable diseases.
Most important thing of this disease is to tell these people early enough so that they know, they are aware that this disease is common in us. This disease, I can have it anytime, and this disease is not painful, so I need to be checked. People actually perish because of lack of information.
Plan International came in. There was an initial introduction through the county that they were interested in working with the youth, and especially in prevention activities and or other measures to reduce this menace of lifestyle diseases among the youth.
So Young Health Program is a very interesting and unique program. First of all, we are funded by AstraZeneca, which is a pharmaceutical company. The program is supposed to be running for 5 years. We started in 2016, so it's going to be running until 2020. The objective of the program is to improve health and gender equality among young boys and girls aged 10 to 24 years living in the informal settlement of Kibera. And our sub-objective is to ensure that these young people are practicing none or very few NCD risk behaviors. And these risk behaviors are those behaviors that we call modifiable risk behaviors. They are behaviors like tobacco use, harmful use of alcohol, unhealthy diets, and physical inactivity. But even as we do this, we also try to integrate interventions to try and respond to risky sexual behavior among young people as a cross-cutting issue, but also issues around gender equality, just ensuring that young people are embracing the different gender roles and gender equality aspects within their community. The program is implemented in Kibera. Our direct target is 8 villages, but we reach out to the entire Kibera. Kibera is made up of a total of 13 villages. Our target is to ensure that by the end of the 5 years, then we have reached more than 90,000 young people with information on NCD risk behaviors, and that their participation in these behaviors are greatly reduced, and therefore by default reducing the increasing burden of non-communicable diseases among young people.
As a young person, I think it's important to address health issues at a young age because this is a time when we eat anything, we eat a lot of junk food. It's the time we don't do exercises, we just want to play video games and watch movies. It's a time when we're now exploring our sexual reproductive health. So this is the time when we are supposed to alter our lifestyles.
When we started, we conducted 2 studies. So one of them was a baseline survey. And our baseline survey was looking into the various NCD risk behaviors and trying to establish how many young people are involved in these behaviors. So from that study, and the report is out, majority of young people smoke, take a lot of alcohol, they don't do exercise, and yet they eat unhealthy foods, mainly the junk foods, in the informal settlements. When we looked at this, then we decided to design Young Health Program in a manner that it responds to some of these behaviors and some of the reasons why young people respond to these behaviors. We've structured YHP into different segments. So the first point is We have an implementing partner that we work with called Ananda Marga Universal Relief Team, AMUT, Kenya. AMUT has a lot of experience in peer education, but also in mass events in the community. So Plan plays sort of the lead role as a lead partner, and then AMUT is the implementing partner.
Kama inaendelea, unarudi wapi? Hospitali.
Some of the key strategies that we've been put place to be able to deliver this project is one, we are keen on peer education, which is our main entry point to this project. We have a system of peer educators who are basically identified from the community. They come from the same community. They are well versed with the community, and they've also had an experience of working with the young people and also the general community.
One of the strengths of this project is that we work with young people. Now, young people constitute the largest percentage as an age group in the Kenyan population. So having a project that targets the young people definitely means we are first of all targeting the biggest chunk of the population, but we are also targeting the next generation of this country.
We have an approach which we call it the School Health Club approach. Our peer educator goes to this particular school and conducts session to these learners or the members of this particular club. The other strategy we have is the community one, where the same peer educators also conduct community peer education sessions. They have a seat and they're taken through the particular curriculum. We have mass events that we also conduct in the field. We have fun days, we have sports days, that's the tournaments, and we have school galas. For the fun days, we create this one day that people come and get involved in different fun activities. But our main aim is to create awareness on NCDs and also to make these people able to participate in these fun activities so that they may also take part in physical activity, enjoy, but learn at the end of the day. The school galas, we work with the schools that are around Kibera. We bring them together and we make them come with performances that are themed to NCD issues. So they can present, for example, they can present health talks, others present poems, and mashairi, others have dramas, others contemporary dance, that all are themed to this. But our main aim at the end of the day of these mass events and everything that we are doing is to create awareness of NCDs.
A community dialogue, it's where you invite the community members and then we discuss the young health program. Specifically, we deal with the risk factors that lead to non-communicable diseases. So we tell them actually it starts with what they know and then we tell them what we know. Then we try and create something like a dialogue where we discuss what we know, what we don't know until we come to a conclusion. So basically, as we have the facts, then they also have facts, yes, but they also have myths. So we try and teach one another.
What we've done working together with the young people is just to ensure that we are innovative as much as possible. New ideas keep coming on board. We try them, whatever works for us, we buy that. What doesn't work for us, it's a lesson learned, then we move forward. So magnetic theater as a strategy or as an innovation came on board, and we use themed magnetic theater sessions within the community.
What we do mostly is magnetic theater, where we go in a community, then we start doing something, we get an audience, then we pass information. So through partnership with Plan International and Ananda Marga Universal Relief Team, that's AMUT, we've been sensitizing the community on health issues since 2017, and we are still going on. So we believe that through theater, the community will be in a position to get this information very quickly, and they'll be empowered with the same information.
There's tobacco, which is a key, a common factor in non-communicable diseases. So then we also enlighten young people and just let them know tobacco really will lead to non-communicable diseases, and it's important you have this information and not use tobacco. For those who are using, to stop. For those ones who are not using, then our focus is to ensure that they don't use tobacco. In school, we talk about use of alcohol. In the community, we talk about harmful use of alcohol. We encourage them to reduce on alcohol. while in school we encourage young people not to indulge in alcohol. We want to enhance the information to young people. We want to ensure that young people are able to change their attitude and they're able to change their behavior today so that they're able to improve their health beginning now and moving to the future.
A larger percentage of the community here, it's young people. And it's clear that a young person, it's easy for him or her to listen to another young person.
You know, when you talk to them and you tell them, oh, when you take this, you are more likely to get hypertension or diabetes. And I use my example, for instance, because I am hypertensive. So I use myself as an example for them not to follow that path, or maybe not to do some things that they can get the risky behaviors and also the NCDs.
For us, we're looking at investing in community change programs that would empower the youth to take better control of themselves, better control of their behaviors, understand NCDs and where what you do today, how does it impact on your health tomorrow. The youth are actually one of the biggest contributors. So if we can do a lot of behavioral change today by advocating that, raising the level of awareness, training peer-to-peer educators, then I think we'll have achieved at least a very good substantial cost saving for the government on those future NCDs that they would have to have treated.
If you want your program to be successful, you have to ensure that you're building synergy through collaboration and partnerships. And we've been able to do this with the government through the various relevant line ministries. But apart from the government, we have also been collaborating a lot with the private sector, especially from the lowest level, where we are talking about private schools, private health facilities within Kibera. We are talking about other pharmaceutical companies that are existing and are willing to put their investment into this. We're also working with other civil society organizations who also have programs that are relevant to what we want to do.
Carolina for Kibera has been working with a young health program, Plan International. Plan International trained us on youth-friendly services. Youth, most of the time, they don't want other people to see them when they want to come and seek services. Our youth-friendly corner becomes different because we offer all services under one roof.
We realized that there is no budget estimate for whatever we were advocating, and it has to be informed by a group of activities in terms of a strategy. So what happened, we felt that probably we were advocating on a very plain ground, and we felt it is important we form a coalition. So that this coalition, we pull resources together, we pull technical expertise together from different organizations so that we can advocate for non-communicables from a joint point of view. And through that approach, we've been able to attain so much. We were able to develop a strategy that is costed, an NCD costed implementation plan that has budgets. We are now advocating for allocation from the county budgets. And there is a huge commitment, there is goodwill from the county government, and they're willing to continuously implement that costed implementation plan to ensure that NCDs are addressed in the county.
At the moment, within Nairobi County, we have already made strides because we have an NCD costed implementation plan in place, which is the first ever in Kenya. At the same time, we've seen an NCD budget line standing alone and some resources allocated to it. Okay, so moving forward, we want to see the costed implementation plan resourced by the Ministry of Health and implemented. And number two, we want to track that budget that has been allocated to ensure that it is accessible to the various departments and that it can be used to do that which it is meant to do.
Vijana wengi wameanza kuacha ulevi. Hiyo tumeanza kuwa na balance diet, unakula kulingana na vile unafaa kukula, si ile yenye tulikuwa tunakula bora kukula, sasa tunakula kukula bora.
Young Health Program imetufunza jinsi ya kukula vyakula, balanced diet, carbohydrates, proteins, vitamins, na tena imetufunza vile unaweza pata mafunzo na pia uende ufunze wengine kuhusu madhara ya pombe, madhara ya sigara, bangi na kansa, magonjwa tofauti tofauti.
they themselves taking up the mantle to educate other peers, because remember, for this to be sustainable and long term, you must get the people to educate each other.
I want to thank AstraZeneca for the resources that they've been able to give us to do this program. Without their support, we wouldn't have reached the many young people that we have reached. In terms of milestones, we have achieved more than 50% of our target. And we are talking about 50% of our target just after 2.5 years, which means we are on track. So we are talking about, I think collectively about 45,000 young people out of 82,000 young people that we target. At national level, we've also supported and even technically participated in the review of school health policy, as well as the school health policy guidelines. And initially, there was not so much focus on NCDs within the school health policy. But right now, as a result of that review, we have seen NCD being given prominence within the school health policy as well as the guidelines. For me, I am looking at a time when we will be able to scale up beyond Kibera. So if that opportunity is there, whether it's from AstraZeneca or from any other partner who is willing to scale this up, then it will be a go-to opportunity, because whatever we have done with the support from AstraZeneca in Kibera is working. We have seen its fruits. And that is why we are getting calls from different informal settlements to be able to scale up the same.
Each of us, as a Kenyan, as citizens in this country, and as partners even in the private sector, I think we have a mandate to really support the big agenda item ahead of us.